Nice. This is translating a very shortcut story about my work with quinoxalines. First of all, I started with quinoxalines and anti-inflammatory compounds. But then, upon researching about the historical aspects of quinoxalines, I found that it may be a very potential antiviral agent. So upon searching that, I found it has a very deep history about antiviral activity, including indolo, quinoxaline, B22-0, quinoxaline carboxylic acid ester, which is opavirylene, dimethoxyquinoxaline, and also the fourth one, which is S2720. All these derivatives starting a potential activity as antiviral quinoxaline compounds. Okay, can you hear me?
Yes, we can.
Okay, it's fine. Upon facing COVID and many unexpected viral infections during recent years affecting our life, and we found that the unexpected epidemic condition and outbreaks appeared in several countries or even globally. So it was my concern to return to quinoxaline as antiviral agent again. And we found that several quinoxaline naturally occurring quinoxaline compounds found in the environment and in nature having antiviral activity. Upon demonstrating some isosteric replacement, some substituent variations, and some drug design rationale upon these derivatives, we found a very potential synthetic quinoxaline compounds. This was the first step in synthesis of some quinoxaline derivatives after searching with a systemic review published in Molecules that showed the importance of quinoxaline derivatives against DNA virus and RNA virus. So I start my work having five sequential schemes, as you see. The first one reacting with dimethylquinoxalinyl acetate, reacting with guanidine in basic medium, sodium hydroxide under neat condition. Then with level of ammonia molecule, getting pyrazolyl quinoxaline compound 3A. Also, I dealt with methylquinoxaline using malononitrile ethanol triethylamine as a basic condition. So two non-isolable intermediates get the fused pyroquinoxalinone. And also, I react methylquinoxaline with malononitrile in ethanol triethylamine to get pyrimidinylquinoxaline. Quinoxaline dione was also my subject to make further modifications, reacting it with hydrazine hydrate to get hydrazide derivatives, and then reacting with diethyl acetylene dicarboxylate to get the corresponding diester compounds 13 and 15. Also, dimethyl quinoxaline hydrazide reacted with different barbomophenyl sulfonyl chloride, triethyl also formate to get compound 16, 17 respectively. That reacted 17, the last one, reacted with 2 amino pyridine and mercaptoacetic acid to get the final product 18 and 20. The point here, we make a different isosteric replacement and different drug rationale in this work. I intended to start with different starting quinoxaline derivatives, dimethylquinoxalinyl acetate, in this first scheme, O-methyl quinoxaline in the second scheme, and quinoxaline dione in fourth scheme, as well as the hydrazide derivative in fifth scheme, to cover different isostate placement and implement side chain elongation or shrinkage and so on to get different derivatives to cover the hydrophilic hydrophobic characters that control the antiviral activity in tissue culture. And all these compounds in Alabama University was subjected to screening about different, against different viral, like hepatitis B, hepatitis C, herpes simplex, and cytomegalovirus. The most potent and the most potential effect was shown against human cytomegalovirus. We found that I have compounds 1B, 15, and 18. All these test compounds we compared against ganciclovir as antiviral agent. So this compound 1B, 15, and 18 showed EC50 higher than 30 micromole, but the safety and the safety measures with them were equal to each other. But the most promising and the most potential compounds were the first one, compound 1A, and the last one, compound 20. Both compounds having 10-fold more potential as antiviral against human cytomegalovirus compared to ganciclovir, producing EC50 lower than 0.05 micromole with selective safety selective index of higher than 2,619 micromole, several times more safe than ganciclovir. All these compounds will be subjected for more modifications and more molecular simplification. In the future work, I will intend to place the quinoxaline moiety with a simpler moiety to produce simple based molecules to test them against the virus, human cytomegalovirus, to make a complete profile about this activity. Also, this test in Alabama University was subjected to show and appear effective dose 50, effective dose 90, and cytotoxic activity 50%, as well as the selectivity index for all compounds. This was a very shortcut about my work with quinoxaline, but nowadays, actually, after this research, I was oriented to testify the potentiality of quinoxaline derivatives as anti-cancer tyrosine kinase inhibitors, and this was a very deep and long story to get many potential compounds. So from this, all of this, I think quinoxaline derivatives will be a very rich source to get and discover more antiviral compounds. Especially nowadays, we have a fear from epidemic infections, viral infections, and unexpected global crises. Thank you very much.